It's time now for Health Watch. And statistics show that someone in America suffers an aneurysm every 18 minutes, which can be unpredictable and a life-threatening medical emergency. About 3 to 5% of the U.S. population live with an unruptured aneurysm, and that was the case for a local woman. Lisa Woodward of Shreveport went in for a routine dental appointment, which ended up as a trip to the emergency room.
They did a bunch of scans, and that's how it was totally accidental.
An aneurysm is a weak spot in the blood vessel that then bulges out, making it more likely to rupture. Smaller aneurysms often don't cause symptoms, but larger ones can lead to serious issues like headaches, loss of consciousness, drooping eyelids, vision changes, loss of balance, or difficulty concentrating. If an aneurysm is over 7 millimeters, the risk of rupture increases significantly. Woodward, for instance, was asymptomatic and delayed seeing a specialist due to a misreading of her aneurysm's size. It was initially thought to be 1.5 millimeters, but it was actually 1.5 centimeters or 15 millimeters.
I drive for a living, and trying to see, to pass and see, it was getting to where I couldn't even turn my neck. It was so bad. When I went to him, he said, that's where it's at, right there.
Woodward's doctor, Dr. Ashish Sonig, is a neurovascular neurosurgeon with Willis-Knighton Neurovascular Institute.
Let's say the same patient would have been there like say 15 years ago, then the only possibility for her would have to undergo a very complex treatment by which you have to basically open the skull, see the aneurysm. At the same time, you have to open the neck to ligate the artery.
Flow diversion technology and biplane imaging is a minimally invasive procedure where neurosurgeons insert a small tube in the leg and carefully guide a catheter with a stent attached through the blood vessels to reroute blood flow away from the aneurysm. Dr. Sonig has performed this surgery many times in his career, but during Brain Aneurysm Awareness Month, Woodward was his first patient at Willis-Knighton.
You could see the aneurysm, and then as soon as he put that stent on, she said it was gone.
You're 17 times more likely to develop an aneurysm if you have a family history, and later Woodward found out her uncle actually died from an aneurysm at the age of 50. And if you have a family history of a brain aneurysm, it's highly encouraged to schedule a CT scan.